I'm Kira from Carrington Hospital Home Health. Thank you so much for meeting on Zoom with me today. I understand that you were recently discharged from the hospital after having a non-STEMI, is that right? Okay. I am so sorry that that happened to you, but I'm really glad to see that you are at home and you are recovering. That's great. I'm here primarily today to follow up with you and provide you with a better understanding of the physiology related to the heart attack that you had. So to start, a non-STEMI or an NSTEMI is just a different way of describing a heart attack. This is what happens when there is a limited blood supply to the heart tissue, which causes that tissue to die. This is a life-threatening condition and very scary, as you know. You might be thinking, well, what causes this? Why did this happen to me? And there are many things that cause this to happen. The most common one is that there's a blockage in the coronary artery of your heart. The job of the coronary arteries is to supply the heart muscle with fresh blood so it can work properly, and anatomically, it is located right on top of the cardiac tissue that's affected when these arteries are blocked. When artery blockage takes place, whether it's from plaques or vessel constriction, blood flow in that area is impeded and the heart cells and the muscle begin to die. Unfortunately, when this happens, those cells die very fast and they don't regenerate. And you begin to experience the signs and symptoms that brought you to the hospital. When these heart areas are 100% blocked, there's no nutrients getting to those cells, they die and they do not come back. And this affects how we render your treatment in the hospital and how you recover at home. When tissue and cell death take place in the heart, they begin to release different components into the blood that we can test and use to diagnose the heart attack and begin your treatment. These components are called myoglobulin, troponin, and CKMB. And all of these things are released at different times during cell death, and that's why there are so many blood tests while you are in the hospital. Even though you did have a heart attack, you can still recover after hospitalization and live a happy, heart-healthy lifestyle with some modifications that my healthcare peers will actually discuss with you next. So take care, and I hope you have a happy, healthy recovery. Bye.
So let's talk a little bit about some of the signs and symptoms that go along with this condition. Most people think of that very typical chest pain or pressure. Some people know about pain in the jaw or radiating down into the arm, but there's lots of other signs or symptoms that can come along with this. One of the big ones is a feeling of anxiety or impending doom, just that general feeling that something bad is going to happen to you. You can also have some numbness or tingling in your arms or sometimes even in your face. Your skin might get cool, clammy. You might get sweaty. Some people even have feelings of indigestion, nausea, that pressure in the lower chest or abdomen. Also dizziness or just feeling really tired or fatigued. You can also get pain back between your shoulder blades. That's really common. That's called referred pain. So even though the pain is originating in your chest, where you're feeling it is in your shoulders. Also down into the left arm, like we talked about. And that pain is like a tight pressure for most people, but it can vary. Some people have pain in the neck or tightness in their neck. Palpitations or that feeling of fluttering in your heart or your chest. Your heart might feel like it's beating really fast, or it might even feel like it's beating really slow, and that might contribute to some of those feelings of anxiety, is just knowing that your heart doesn't feel like it's beating right. It gives you that feeling that something's bad is going to happen. And then when we add in things like that fatigue or that dizziness, those are really strong signs that you need to get checked right away. If you're having more than one of these symptoms, especially, it is a good indicator that we need to get your heart checked right away. And the sooner you get to emergency care to get evaluated, the better the outcomes will be.
Hi, I've been asked to talk about some of the diagnostics related to myocardial infarctions, specifically ST elevated myocardial infarctions, or STEMIs, and non ST elevated myocardial infarctions, or NSTEMIs. So, we're going to use several different diagnostic tools to help us determine the severity of a heart attack. One of those is a CT angiogram. This is using a specialized X ray that takes 2D cross sectional images to look at the blood vessels in the heart. This is a very useful test because it can tell us if the blood vessels are becoming narrowed or if they're blocked entirely. And if they are, that implies that the areas distal to those blockages aren't getting perfused as well as they should, and that could lead to tissue death, which could cause STEMI or NSTEMI. Another thing we're going to look at is a EKG. This is an electrocardiogram. It's measuring the electrical function of the heart and the action potential of the heart. This tells us if the heart's rhythm is functioning as it should be. Just because the rhythm is functioning right doesn't mean that the mechanical part of the heart or the muscle is functioning right. So we also want to get an echocardiogram. This is going to use technology similar to an ultrasound to look inside the heart and see if it's pumping effectively. And that'll tell us more about the mechanical function of the heart. Next, we're going to get blood tests, and we're going to look at cardiac enzymes such as troponin or BNP. This is going to tell us if there's been any tissue death in the heart or cell damage. If it's elevated, that means that heart cells have died, releasing what's normally inside heart cells to be outside heart cells, which we can detect in the blood. These tests will help us determine the severity of the occlusion and if the patient is having a NSTEMI, in other words, damage to the heart tissue without any changes in the EKG, or if they're having a STEMI, which is damage to the heart tissue sufficient to cause changes in the EKG, usually caused by a complete blockage of one of the arteries supplying the heart muscle. Thank you.
My name is Molly. I heard that you recently suffered from a heart attack, and I just wanted to touch base with you about some medications that may be prescribed and some treatments as well. The medications and treatments you are given really depend on how severe the NSTEMI is. Once you're in the hospital, you may need oxygen and possibly defibrillation. Since you're no longer in the hospital, we don't really have to worry about that anymore. Depending on how narrow those arteries were, some people may need surgery. It's possible a stent can be placed, which is a little device that holds the arteries open wider to allow blood through. Some people can also get angioplasty, which is a balloon that is put into your arteries and blown up to open them up more. In some cases, coronary artery bypass surgery is needed. This surgery moves blood away from those more narrow arteries to more open arteries so the blood can flow through them to your heart and then throughout the rest of your body again. Now, luckily, you didn't need any of those procedures, but there are some medications that more than likely are going to be prescribed to you. You may be prescribed aspirin if it's not contraindicated to you. Aspirin has some heart protecting properties, so it may help to prevent further heart attacks. Nitroglycerin might also be prescribed. It helps to open up those arteries so blood can move more easily through them to your heart and the rest of your body. If you have any chest pain, it will also help with that. With nitroglycerin, it can cause some dizziness and lightheadedness, so it's important to watch for that and sit down and kind of take it easier once you take those meds. Lovenox or heparin may be given as well. These both help to thin the blood, making it easier to get through the arteries. With those, you do need to be careful of bleeding since your blood is thinner. If you get a cut or if you're brushing your teeth and your gums bleed, that can lead to some serious problems. So just be sure to watch for that. Lastly, you may be prescribed a statin drug. This drug will decrease your cholesterol by blocking the liver from making it. This will help prevent more of those arteries from being clogged. So now that we've talked about some of the treatments, I will pass you over to another member of the team to discuss some lifestyle modifications. Thank you.
Good afternoon, my name is Derek. I'm here to talk you through some possible lifestyle modifications that you might want to do, which will be helpful for you now that you've had a heart attack. I see that you have your family with you here today, which is amazing because family support is very important in this time, and making these changes is going to benefit everybody's health. So today we're going to talk about tobacco products, alcohol consumption, blood pressure, weight reduction, exercise, and what you eat. So tobacco products. Well, I guess let's talk tobacco and alcohol. Do you guys smoke and drink? No? Wow. Oh, that's cool. Okay, so that makes it so much easier. I'll just hit the basics real quick. say tobacco, it's going to constrict your blood vessels, and since you had some plaque in there, and it was constricting the blood flow, you don't want those blood vessels to constrict. So if you have friends that smoke, if you guys are outside hanging out, like still hang out with them, but let's just step upwind. Then you're not going to have that kind of thing affecting you. Alcohol consumption. Do you guys drink? No? Okay. Let's just stay on that same bandwagon. No drinking's a good thing. All right. So your blood pressure, we're going to want to reduce that. These other things we're talking about constrict and bring up your blood pressure, which weight also does. We're going to want to work our way through diet and exercise to lose some weight, which is going to help bring our blood pressure down. When we're talking about exercise, start off at a moderate level. Just go for a walk with the dog or your family a couple times a day. 2 or 3 laps around the block would be a good starting place. And then as you're feeling good, double that, triple that. And you may want to get into some exercise, like some resistance training, and strengthen those muscles. So how do you guys eat? Okay, the normal American diet, lots of processed food and fast foods. Okay, it would be beneficial if you ate at home more, because a lot of fast foods have a lot of sodium, which bring all that fluids in your blood vessels, and your volume is going to be high, therefore your blood pressure is going to raise with those kinds of things. So limiting those kinds of things, really salty foods, fatty foods because of the lipids and clots. What you're going to want to do is think more natural. Think vegetables, lean meats, fruits. The lower processed, the better. So knock off some of that mac and cheese, and we'll bring in a nice chicken salad, things like that. Not to say that you can't have those things anymore, but you want to bring those processed foods down as much as you can. If you want more information, I'll make sure that I can connect you to a dietitian if you'd like. Okay, so that sounds like some good changes. All right, you have a great day. Bye.